Hey everyone, and welcome back to Maternity Monday. I am Dr. Dali here with.
I'm Dr. Valerie, and today we're going to dive into a really powerful topic often that it's often celebrated, something challenging and always important: breastfeeding.
Yes, and whether you are currently breastfeeding, planning to, or just want to understand more about it, how everything works, this episode is packed with information, encouragement, and a little bit of real talk. So let's start with why breast milk is magical for babies, Valerie.
So, breastfeeding is not just for food; it is a living intelligence system that literally changed to meet your baby needs. Did you know it can change during the same feed, depending on the time of the day, the age of your baby, or even if your baby is sick? And that's why you cannot have your breast milk, leave it in the counter for hours and hours. It will get damaged, and it's because it's a living cells in that milk. Breast milk has innate intelligence. If a baby is born prematurely, the mother's food adapt and produce milk with higher levels of protein, nitrogen, and growth hormone, especially to support the baby growth.
Yes, breast milk is amazing. And it comes in three key stages. The colostrum, which is the first day until like around 7 days, and it's thick, it's a golden first milk, is yellow, and produced right after birth. So those first 1 to 7 days, more or less, is a colostrum, and is so important. It's packed with immune boosting antibodies, vitamin E, amino acid, which will support your baby's brain, the eye development. It even helps to flush out your baby's system and sets the foundation for a healthy digestion. And bonus, if your baby has like something in the eyes or some spots in the skin or something, you can put that breast milk on them and it will do wonders. Just wait to dry it up and then just put a little bit again all during the day and you will see magic happens. The second one is transitional milk, and that one is around day 7 to 14, more or less. And that one is a transitional milk, and it's richer in fats and lactose, and it would help baby to gain weight. And the third one is the mature milk, which is after about 2 weeks until you stop feeding, you will have the mature milk and and that's what baby's gonna be feeding. And when that one kicks in, the balance of fore milk and hind milk ensures your baby gets hydration and nourishment.
So let's talk about what exactly it's in the breast milk that make it so powerful. So like golden liquid, a lot of the moms said.
It
Uh,
is.
so it easily absorbs zinc, iron, and iodine for brain development. Lactalbumin, which is a whey protein that it's easier to digest than the protein in the formula. Live antibodies that adapt to the germs your baby is exposed to. That's huge. Research has shown that breastfeeding have lower rate of respiratory infections, ear infection, and gut issues, and lower the risk of SIDS, diabetes, and childhood obesity. So there was a research spotlight. A 2021 study published in Lancet found that breastfeeding is linked to a 26% reduction in breast cancer risk for moms and contribute to a higher IQ score in babies later in life.
Yes, it's so important, and not just for babies, for moms too. There is a lot of benefits for us as breastfed moms, that it will honor us. For one, it will help the uterus contract back to its pre-pregnancy size, reducing the postpartum bleeding. So you will recover beautifully. It also supports hormonal balance. It will help with your weight regulation and even creates a bonding time that encourages mom to slow down, sit, rest, and connect. And yes, it's not always easy, especially at the beginning, but it's very worth it. And it will help mom and baby in so many ways.
Oh, yes. So breastfeeding is challenging. So let's talk about the hard part of breastfeeding. It's painful. When you start breastfeeding your baby, you're going to have a lot of pain in your breast. It's going to be really hard. So there are different things that you can use. You can put some heating pads. It will help. Usually, if they're really, really bad, some doulas recommend ice too. So depending what's going on your breast, but you can also have crackle nipples. So you can use there's some nipple butter that you can put to help hydrate that area and prevent that to happen. It's gonna be exhausting. You're gonna be really tired and really hungry too. It's time consuming, especially in the night, because you're gonna, depending on your baby's schedule, it could be every 2 hours, 3 hours, 4 hours. It will be depending in what stage is your baby, but it's time consuming. And it's frustrating if you're unsure if your baby is getting enough milk. So the fear of, do I have enough milk? It's a super common question that a lot of mom has. And the truth is breastfeeding works on supply and demand. So the more you nurse, the more your body produces. So in the early days, it is best not to worry about the strict 3 or 4 hour routine. Instead, let your baby guide the feed and trust your body to respond.
Yeah, it's very important you don't just like get them, oh, I need to sleep, so I'm gonna have them like very strict, like every 3 to 4 hours now. Just if you can do it at demand, it would be way better because the baby will let you know when it needs to be fed, and especially for milk production, like that will help you to produce more and more and more because baby is there feeding
Yeah.
more. And that
Even if you're
suction stimulates your nipples and your breast to produce more too.
Yeah, that was something I was gonna say. Is like, if you're not producing enough milk, just put your baby, let your baby stimulate. Don't get anxious. Don't put the machine to suck on your
Mhm.
nipples. It's not, no. Put your baby, because your baby had some in the saliva. There are a few different like receptors that are gonna stimulate your breast, that you need to produce more. So that's important to have in
Yeah.
mind and not just put the machine on.
And skin to skin that we talk about in last videos.
Yes.
Skin to skin is gonna
Yeah.
help to produce a lot more too and like just regulate everything for you. Let's just do some tips for a smooth breastfeeding journey. And if some tips are hydration, so important. Your milk is full of water and your baby needs that. So the breast milk is over 87% water, so your body will need fluids to keep producing. So have a bottle of water everywhere in your house. Especially if you are breastfeeding in that moment is the best time to just, you're calm, you're sitting, you're relaxing, just have your cup of water with you and just hydrate a lot in there. Eat nourishing food, especially protein, healthy fats, and complex carbs, not simple carbs. If you can just get those out of the way. Especially protein and healthy fats, those are the main ones because your milk is passing that to your baby, and your baby will need that to gain weight and be healthy and get nourishment from it. And get help early. If you're struggling, finding a lactation consultant, that can make a huge difference. That can help you a lot with how you position your baby, how you're doing everything. Even for production, if you're not producing enough, they will let you know. So just ask for help if you need it early on. Don't wait until like a month and it's like, oh, it's been a month and he or she's not feeling well. No, just ask for help early on, and lactation consultants are great. So find one that is good fit for you. And remember that your baby is learning too. So be gentle with yourself. Breastfeeding is natural, yes, but it's also is learn. So not just the baby's learning, but you are learning too. So it is going to be a process, it's a new skill that we are learning with baby. So we are both learning, so just be patient and be relaxed as much as you can because stress will cut that production too. And if you have breastfed before, let us know what was the most surprising part of you. Did you like it? Did you not like it? Just drop it away in the comments and we would love to see your comments.
So whether you are on day one or a month 10, remember breastfeeding is a journey. It is not about perfection, it's about connection, nutrition, and showing up for your baby in the way that feel right for you and also for your baby.
Yes, and we hope this gave you some insight and encouragement. Stay tuned for next week, Maternity Monday. And if you have any question about breastfeeding or chiropractic or anything that we have talked about, just leave a comment below and we will be more than happy to answer any questions. And make sure to follow us on Instagram and share this episode with any other mamas who might need it. So thank you for tuning in, and we will see you next week.
See you next week.